Hello, Dick. I wanted to respond to your video how Obama will ruin healthcare. Being a Canadian under a socialist type of system, I believe that I understand and have studied healthcare a lot more than many Americans have. I don't mean that as a shot by any means. It's just that I've been able to live under this system and watch the American system. And the first thing I'd like to say is I am a staunch conservative, for lack of a better term. I do not believe that George Bush was right to start the bailouts of any company, and I do not believe in no bid contracts, even for small items like paper clips, where government people can write checks for anything under $1,000 with no bids, because then you're going to get millions of orders and supplies of paper clips for under $1,000, and then you're going to get only two companies involved in kickbacks, and we all know how that works. So fiscally, I'm very staunch conservative, and traditionally very staunch conservative, but I won't get into that. What I want to talk about is the difference between the private and social healthcare systems, and which is better. Now in Canada, just throw some numbers at you, the average Canadian makes about $30,000 a year, the average American makes about $40,000 a year. Let's put aside the exchange rate for a minute. And of course in Canada, with the federal, provincial, GST, hidden taxes, out of your $30,000 you're left with about $15,000. But of course then your health care and medicine is not medicine, but most of your health care is so-called free. It's not free, you pay for your taxes. In the States, if you make $40,000 a year, your taxes might only be $10,000, 25% of your income. But then you have to buy your private health care insurance for your family or yourself, which will cost $8,000 to $10,000 a year, and you're down to $20,000 income, 50% of your salary. But of course, you say, well, it's still better off in the States because your wages are slightly higher. But suffice it to say that we're all paying for it one way or another. The issue is not so much, I guess, socialism and privatization. I don't believe that there's anyone smart enough that has come along, not you, not me, not any politician, not anybody, that can figure this out. Let's just talk about the humanitarian issue for a minute. Now, I know and I believe that Obama is ruining your country, first of all by spending too much money, and then by appointing people like Joe Biden. That's another issue, and many other issues, but let's leave that aside. If we look at it on a humanitarian, just as a person, a human issue, if a person's sick, they need a doctor. The issue becomes, if a person has a heart attack, should that be paid for, the operation, should that be paid for by everybody, or should it be paid for by the individual? And if the individual doesn't have the money or didn't get insurance, too bad. In the other system, if the individual doesn't have the money or their insurance, then everybody pays for it anyway. If we can agree that when a person's sick they need a doctor, hopefully we can all agree on that. I haven't been brainwashed by the Canadian system. There's waiting lines. Contrary to popular belief, by the way, if you have a heart attack in Canada, you're more likely to get in right away than if you need, say, a hip replacement where you'll have to wait 1 or 2 years. But we can debate and say, well, the quality of healthcare in Canada is not that great, and the waiting lines in this, so that's another issue. But again, back to humanitarian. If a person's sick, they need a doctor, fine. But does everyone pay for it, or just the person who's sick? And if the person who's sick can't afford it, too bad. That's it. Many people believe that. It's called the individual responsibility. If you don't look after yourself and your own financial needs and your health needs, and you happen to fail or fall or die, that's the way life is. Other people know we should all share in that, and we should all take responsibility for everybody. But then you say, well, that becomes too socialistic. I just want to look at it on a strictly humanitarian basis. And a lot of people say, well, you can't just look at it from that angle either. I just don't believe anyone smart enough has come along to figure this out. Should it be one way? Should it be more of a socialist system just for healthcare? Or should it be simply private? Or should it be a combination of the both? I mean, I realize in Canada there's a lot of people, including high-level politicians, who are not happy with our healthcare, even though they advocate it, and then they go to the States and get their operations anyway. I'm totally aware of that. But I'm wondering if you could make another video or something written or a statement of what is the best way, or the most logical way, or the most humanitarian way, or if you exclude humanitarian way, or it's just a matter of individual responsibility, or is there somebody smart enough that can figure this all out? I don't believe that anyone is, and I believe that's the problem at the moment. There's just nobody out there that is smart enough and logical enough and can balance this all to figure it out and what's the best way. Thank you.